People usually come in to see me as a vulvar dermatologist when they're having a skin problem in the vulva that they can't figure out what it is. Most common is itch, so vulvar itch or vulvar pain. Sometimes people have rashes and sometimes they don't have rashes, but if the skin is itchy or painful, they'll come in, and basically that's my job, is to figure out what's causing it. My training in vulvar dermatology was done in England in my residency, actually. So more than 15 years ago is where I trained by a woman, Sally Neal, who that's all she does is vulvar dermatology full time. Since then, I've practiced vulvar dermatology, and generally I see two to four patients a day that are just for vulvar dermatology. Usually referred by other dermatologists or other gynecologists. All derms and gyns know a bit about skin problems of the vulva, but it can be very helpful to sometimes to see someone like myself who has a more extensive experience with it. I will go to trainings for vulvar dermatology, specifically with the Society of Vulvovaginal Disease. International Society for Vulvovaginal Disease has the most up-to-date sort of trainings and education and research in this area, so I always keep up that way. So vulvar itch can be a symptom of a sexually transmitted infection. Often, honestly, by the time they see me, that's been ruled out. So when people have these problems, often first they'll go to their gynecologist, and that's sort of the first round of testing that's done. And often that comes up clear, but they're still having the itch, and they can't figure out what's causing it. And then generally that's when they're referred to me as a sort of like a subspecialist. Those kind of things have been ruled out, and we're trying to figure out really what's the cause if there's a skin problem. And it's not anything to be embarrassed about that you're having a skin problem in the vulvar area. Some people, just think that it means something is dirty or they did something wrong, but it's just another area of your skin. If you have a skin problem there, most, if not all, can be cured or controlled, and we can get you back feeling yourself. So there's skin disorders of the vulva that have all different etiologies or causes. Some are autoimmune, some are allergic, some are just bad luck. We don't know of any cause at all, they just happen. So that's always the first task at hand, is to figure out what the actual diagnosis is, and then see if there's anything that we can do to prevent this from happening in the future. And some of them, we can cure completely for sure. Like if it's an allergic reaction, we figure out what they're allergic to and take that away, and that condition's gone. Other conditions are autoimmune and sort of require ongoing treatment. But generally, in almost all cases, we can get the patient a lot more comfortable, get their skin sort of looking better and being more healthy. And, some of these things we have to have ongoing treatment and monitoring. So some of these diagnoses we could make, just by looking. I can examine closely just with light and magnification and make an accurate diagnosis. Other conditions, we have to do a skin biopsy to figure out, what the cause of the rash is. That can be very scary to the patient. Some people have had biopsies before even that were sort of traumatic to them, and so that can be a barrier for some patients. But I'm confident that I can do a biopsy in almost any patient in an almost completely painless way. I've been doing this now for 15 years. We have methods of, multiple sort of layers of anesthetics and things to make people very comfortable. If a person's extremely anxious, we can also give even sort of mild sedative here in the office as long as they have a ride home. So I don't want anything regarding pain or anxiety to be, a barrier in order to doing what's necessary to come to accurate diagnosis, because we can make people very, very comfortable. Most people are surprised they couldn't even feel anything or any pain when they had their biopsy done. Also, these sites heal very nicely. Usually once it's healed later, I can't even find the site where the biopsy was done. The good thing is that it heals really nicely with almost no chance of any scar or any problem from the biopsy. I've never had a wound infection on a biopsy done in the vulva, so the biopsies can be done very nicely. So treatments for these vulvar skin problems really vary. So some are treated with topical creams or ointments alone, and in some patients that cures them, or sometimes they need to do these ongoing, but sort of in a scheduled way that I can review. Others can be treated with lasers or sort of minor surgical procedures that we can do in the office. Again, this is an area that heals very quickly and nicely, so these treatments can be done with minimal downtime or pain or discomfort. If a patient has pain during intercourse, there's a really wide range of what is causing it and what the treatment options would be. Often this is a case where I will partner with a pelvic floor physical therapist. So there's a subspecialty of physical therapy called pelvic floor physical therapy, and that can be very effective for pain with intercourse. There are also topical sort of numbing medications or skin barrier topical things that can help with just irritation or lubrication. So it depends on what the cause is, but almost always pain with intercourse is very treatable with a combination of topical and physical therapy modalities. Common misconceptions about vulvar dermatology. One is that topical steroids are bad in the vulva. They can be misused, and we always want to know what we're treating so that we know how they need to be used and if it's safe. Certain skin conditions, they normalize the skin and make it more healthy and less chance for any infection or any problem. But there can be drawbacks too, so we always need an accurate diagnosis before coming up with a treatment plan. But in general, once most people know what they can do, where it's appropriate, it's sort of like completely can change someone's life to have that skin feeling normal. I have lots of patients who say they didn't even know what normal was anymore because they've been suffering so long with itch or discomfort or pain just from their skin being so inflamed. So I would say that's the most common misconception, is that topical steroids can't be used. They certainly can be used, and there's good studies of them being used even for decades safely in the right scenario. As long as it's properly monitored, they can definitely be safely used in the vulva. Another misconception about the vulva is that treatments, lasers and biopsies are painful in that area. The truth is, the topical numbing medications that we use before procedures or other lasers actually work even better in that area because the stratum corneum is very thin. And so anyway, the topical numbing medications work way better there than they work other areas, like on your face or elsewhere. So as long as we do, proper things, lasers and biopsies in that area can be almost painless.